Well, it's a big binary catalyst, no doubt, for the managed Medicaid HMOs and for the hospital stocks in particular. If the bill actually gets passed in the House and they can whip those votes, I think those stocks sell off even more. They have been giving up some of their gains. I'm in the camp of I think they'll be able to whip enough votes in the House to at least get it passed through the House. The Senate is another matter, I think. And we can talk about the manager's amendment, which certainly I think isn't improving the situation any. I doubt the CBO score gets any better with this amendment. On the one hand, we've had them appropriate additional funds to appease the senior lobby. So you may see a bit more enrollment in the exchange marketplaces. But on the other hand, for the Freedom Caucus, they have done a big change, I think, in Medicaid. And now they're saying immediately no new states can expand Medicaid with the enhanced subsidies that we had under Obamacare. So this big bull thesis on Florida and Texas expanding Medicaid potentially ahead of 2020 now is not there anymore. So names like Centene, Molina, HCA, Tenet, and the like that had traded up in the first couple months of the year, that thesis goes away.
That's pretty funny, Anna. That just as an aside, you mentioned Huffington Post, big headline. Major healthcare honcho doesn't like, hates this new bill, and it was Molina. And so the Molina stock has been, it's been going down, and that company is one of the losers with this bill. So obviously that's why he's
definitely
squawking about it on Huffington Post.
Yes.
Anyway,
yes.
So you also got to figure out what happens once we get to this. If I were you, I wouldn't know what to do. So once it gets to the Senate, do some of these amendments become less draconian? And does the entitlement state get even bigger once it goes to the Senate? And do you have to take back everything you just said about the amendments? Or what do you expect to happen once we get there?
I think they would end up loosening some of the restrictions on Medicaid to get the vote. There are a number of Republican states, as you know, that have already expanded Medicaid. Some of the Republican governors have come out with a proposal that's a little more moderate. So my view would be they would have to, change it a bit and to get the vote there.
All right.
But, we'll see.
All right, let's take it back to ideas for people that are watching. So you think Humana, United Health, and Anthem all will have upside potential from what happens if this goes through?
Yes. As I had said a couple weeks ago, they have the benefit particularly from the repeal of the Obamacare tax, and then that lays the pathway for broader tax reform, which is huge for domestic companies who are paying full taxes. So when you compare that to any potential downside that United and Anthem have on Medicaid expansion, it pales in comparison to the upside from the taxes. And Humana has hardly any exposure to Medicaid at all. And with the amendment, they actually moved, not for insurers, which are really not impacted by this, but broadly speaking, they had moved the repeal from 2018 to 2017 and are now sunsetting the Cadillac tax repeal a year later. So, all in all, this legislation is great. And I think the stocks have traded up some. I don't think by any means they're reflecting all of the upside. So I'd still be a buyer of Humana, Anthem, and United. I think if, for whatever reason, tomorrow the House cannot whip the votes on the floor, you may see a bit of a sell-off. I would view that as a buying opportunity. Each of those names has a buy thesis that's related to healthcare reform, but independent of the legislation.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.